Yesterday we done with organophosphate poisoning. If someone come to you with organophosphate, I write atropine uses here because big list. Atropine very useful drug.
Sorry, sir, you haven't shared a screen.
Okay. Yeah. Now uses of atropine. First use. A patient come to you have eating or drinking pesticides, insecticide, fertilizer. In the villages, very very common. They try for suicide. The person with broken heart. Of course, they try for suicide. So, how you can save that patient? Give atropine. What happened to patient if you have this poisoning, organophosphate poisoning, very high level of acetylcholine? Yeah. If very high level of acetylcholine, what happen in eyes? Watery eye. What happen in mouth? Watery mouth. Sweating from the skin. From GIT, diarrhea, abdominal pain. Okay. What happen? Respiratory, bronchoconstriction. Heart rate decrease. Understand? So how patient die? Decrease blood pressure and cardiac arrest. Patient can die. We can save patient life by using atropine. Organophosphate poisoning. If any person having like bites, scorpion bite, black widow spider, yeah, venom, they're doing what? Increase acetylcholine. Understand? So to save the patient life, if any type of bites, scorpion bite, spider, black spider, okay, or organophosphate poisoning, poppy poisoning. The poisoning case, very useful drug. Okay, second drug, second use. Patient sudden having cardiac arrest. Use atropine. Number 3. Eye exam. Before tropicamide come, before tropicamide invention, we are just having atropine for eye exam. But nowadays the atropine only used for this like OP poisoning, cardiac arrest, not used for eye exam because now we have tropicamide. Understand? Now we have tropicamide. Okay. Now, next use. Pre-anesthetic. Pre-anesthetic medication. What this means? Before giving anesthesia, if patient undergoes surgery, yeah, you give what? Must make patient unconscious. General anesthesia. For general anesthesia, intubate trachea because patient can't breathe. Intubate trachea, putting tube inside the trachea and attach oxygen with that tube. Okay, put endotracheal tube in trachea. So if you put endotracheal tube in trachea, what happens with all the secretion? Can patient take out secretion? If the surgery went for 2 hours, 3 hours, 5 hours, 6 hours, 7 hours, 10 hours, very long surgery, yeah? It depends upon duration. So patient totally unconscious, all the secretions, all secretion going where? All secretion going till alveoli, going to small bronchiole. Okay. So all the bacteria, if the sputum is not coming out, all this secretion, mucus not coming out, it can lead to pneumonia. Understand? So before giving general anesthesia, before putting tracheal tube, give what? Atropine. Atropine doing what? Atropine decrease mucus secretion. Understand? Decrease all secretion of respiratory tract. It's very useful. So atropine, patient is totally unconscious. Yeah, patient totally unconscious. You know, for surgery, patient must be empty stomach. Patient must be empty stomach for surgery. Yeah. So this atropine also effective in also control GIT, stop the vomiting, decrease the secretion of GIT. So no chance for vomiting is also effective. So it's a very good pre-anesthetic medication. Understand? Before giving anesthesia, give atropine. Atropine decrease secretion of saliva, dry mouth. Yeah, decrease secretion of saliva is also effective because patient unconscious. In surgery, patient unconscious. If saliva too much there, respiratory secretion too much there, so these secretion going deep and deep and deep at deeper level can cause pneumonia after surgery. The big problem, lung infection. Understand? So at the time, during the surgery, you have chance for vomiting because a lot of drugs we use in surgery for anesthesia. These drugs can induce vomiting. So we use atropine. Atropine stop the motility of GIT. Atropine stop motility of GIT. Atropine decrease the secretion of GIT. So no chance for vomiting. Understand? It's a very, very effective pre-anesthetic drug. Use number 4. We use before giving general anesthesia. It's a very, very effective use. Okay. Use number 5. Use number 5. Atropine, use number 5. If patient using overuse of agonist, overuse of agonist like physostigmine, physostigmine overuse, physostigmine overuse, botanicol overuse, carbachol overuse. So if you're using too much, then you can reverse by using atropine. So atropine can block M3 receptor, M1 receptor, okay? Not go for nicotinic receptor, must keep in mind, it's not go for nicotinic receptor, okay? So using, which drug we use for myasthenia gravis? Pyridostigmine, okay? Not mixed with this physo. Physostigmine we can use for constipation like this, okay? If you have some issue with GIT not working, urinary bladder not working. So overdose of physostigmine can be reversed by atropine. Atropine is all this group belongs to antimuscarinic. All these drugs. All these drugs are which group? Antimuscarinic group. Antimuscarinic group M1, M2, M3, M4, M5. They block all these receptors. Understand? So these are antimuscarinic group. This is the first group. Benzotropine, tropicamide, atropine, scopolamine. Any problem with these drugs? The use is clear?
Yes, sir.
Okay. Sometime examiner asks one question from the eye. Alpha 2 doing what? Mydriasis, yeah? Alpha 2 doing what? Mydriasis. M3 doing what? Meiosis. If we're using drug for alpha 2, using drug for alpha 2, epinephrine, norepinephrine, okay? So these drugs directly causing mydriasis. So if we're using pilocarpine agonist, again meiosis. If you block this, then what happens? Only mydriasis, no meiosis here, yeah? Another location of M3. M3 also present on ciliary, muscle, okay? Also present on ciliary muscle control, lens. Control lens. Clear? So it's mean parasympathetic system in eye. Parasympathetic system control iris also, okay, and lens also. Done. Sympathetic system only control iris, have no concern with lens. Sympathetic system only control the diameter of pupil, okay, causing mydriasis. Have no concern with the lens diameter, change in lens diameter. Understand? Have no effect on lens. Clear or not? If you're using drug, if you block this, lens also paralyzed. That effect known as cycloplegia. What means cycloplegia? Cycloplegia means paralysis of lens, eye lens. Paralysis of lens. Eye lens paralysis means the lens not able to change its diameter according to light, okay? The cycloplegia. So now parasympathetic system doing two things in eye. Number one, if you block parasympathetic system, number one, what happens? Mydriasis. Number two, what happened? Cycloplegia. The drug, listen here carefully sometimes. The drug causing mydriasis with cycloplegia. Which drug you choose? Atropine or tropicamide, okay? Any cholinergic antagonist. The drug causing mydriasis with cycloplegia. Drug causing mydriasis with cycloplegia. Drug causing mydriasis here with cycloplegia. Both things. Drug causing mydriasis. Drug causing mydriasis without cycloplegia. That drug belongs to alpha 2 receptor. Just write a name here. Phenylphrine. Phenylphrine. Oxymetazoline. In next section, when we talk about sympathetic system, more clear, okay? Oxymetazoline. So which drug causing mydriasis and cycloplegia same time? Tropicamide. Next one, atropine. Clear? Cholinergic antagonist, they causing mydriasis and cycloplegia same time. Sympathetic system agonist. In next section we'll learn about sympathetic system, okay? Sympathetic system agonist only causing mydriasis. Only causing mydriasis. So drug causing. Can you use for eye exam phenylphrine? Yes, of course you can use. Because causing dilation. If you want to see lens, if you want to clearly see vitreous humor disease, if you want to see retina, you need to dilate the pupil first. For internal eye examination, must dilate the pupil first, okay? Understand? Tropicamide. Why you not use for atropine? Why
Long
not have
acting.
atropine? Very long
Because
acting.
long
The
acting.
patient complain blurring of vision. 1 week, 2 week have problem with the vision, yeah? So we use short acting tropicamide or phenolphthalein. This concept clear?
Yes, sir.
Okay, now move on side effect. What are the side effect of these drugs? Number one, from up to down, okay? Memory loss. Why memory loss? Because block acetylcholine in brain part, yeah? Next effect, in eye, dry eye. In eye, another problem, blurring vision for far or near. If you want to see, for example, you're reading your book. What happened with the people? People constricted, okay? People very small. If you want to see your friend very far from you, so that time people dilated, yeah? For far object, for far vision, people automatically dilated. For near vision, people constricted. Clear?
Oh,
Meiosis. Meiosis for near vision and mydriasis for far vision. Okay, now what happened with this drug? Mydriasis. Now problem for far vision or near vision? Problem for far vision or near vision? Mydriasis. You can see.
far region.
You can see far.
Mm,
You can see far clearly. Okay.
mm.
Meiosis.
Near object.
You can see near. Now problem with far vision and near vision. For example, I put one drop of
Near.
tropicamide in your eye. Can you read your book? It's very
No.
hard to read your book. Near vision blurry, okay? Blurred vision for near. Blurry vision for near. Why? Because my eye dilated, yeah? So if
Yeah.
dilated, then you can see far object, but the problem with near object. If you're using pilocarpine, what happened with your eye, with vision? Blurry vision for far and near. Blurry vision far.
For
Blurry vision for far. If you want to see clearly far, you need pupil dilated, yeah? Pilocarpine
yes.
doing what? Pilocarpine doing what? Meiosis. Clear? So you can see near object easily, but the problem with far object, understand? Blurry vision far, pilocarpine. Blurry vision far, near, atropine, tropicamide. Done? This is a side effect. Number 3, dry mouth. Next, dry skin. In number 4, what happened with heart rate? Tachycardia. What happened with GLT? Constipation. Because you stop what? M3, yeah? Constipation. What happened with bladder? Urinary retention. Not able to pee. Yeah? Urinary retention because you block bladder contraction. So these are the side effects of antimuscarinic. Memory loss, dry eye, dry skin. If you have dry skin, what happens with your body temperature?
Hot.
High.
Increase.
Body temperature high. Body temperature high. Atropine fever. Can you explain this terminology? Atropine causing decreased sweating. Yeah. So the sweating is the one way to get rid of extra heat. The extra heat eliminated the two ways. Number one, vasodilation. Number two, sweating. So if you stop sweating, body temperature increase. Okay? It's another side effect. So these are the side effects: memory loss, dry eye, dry skin, tachycardia, constipation, urinary retention. Clear?
Yes, sir.
Okay. The other groups, right? Another thing. Other groups act like the other groups also sometimes act like anti-muscarinic. Act like anti-muscarinic. So if you understand what are the groups act like anti-muscarinic, then very easily to memorize their side effect, because you know anti-muscarinic side effect: memory loss, dry eye, dry skin, constipation, urinary retention, tachycardia. Clear? So all these side effects, if any drug, first one, antipsychotic. Antipsychotic, they causing what? They have effect like this, okay? Antipsychotic, antipsychotic, antidepressant, antidepressant. So they have same side effect like this: antipsychotic, antidepressant. Number three, opioid, same side effect like antimuscarinic. Opioids. Number four, antihistamine. Antihistamine. So if you're taking antihistamine for allergy, so this antihistamine also having the same side effect: dry eye, dry mouth. Okay, like this. If you're using opioid for pain, if you're using antidepressant for depression, antipsychotic for schizophrenia, having same common side effect. Why they having these side effects? Because they have property of anti-muscarinic effect. Okay, they have property like anti-muscarinic effect. Another group, right? Another group, class 1. This drug will learn in CVS system. Class 1, anti-arrhythmic. Class 1, anti-arrhythmic. Class 1 anti-arrhythmic. This drug we learn in CVS system. These drugs also having strong anti-muscarinic effects. So their side effect common like atropine-like side effect. Yeah, side effects like atropine. Understand? Because they have property anti-muscarinic. Which class? Class 1, sodium blocker. This drug we use for arrhythmia. Sodium blockers. Okay, this we learn in CVS system. So all this is all about anti-muscarinic drugs. All about anti-muscarinic drugs. The next group we learn in next class: neuromuscular junction blockers. These drugs, they block NM receptor. Okay. Just now we finished about M1 till M5 blocking. This we're done. Now it's time for nicotinic receptor and M receptor. Now tomorrow we must define what the difference between depolarizing and non-depolarizing. Okay, it's your homework. What the meaning of depolarizing blocker? There are two groups, and non-depolarizing. What the difference between these two? Okay, how they paralyze your muscle, how they relax your muscle. Depolarizing and non-depolarizing. In depolarizing, just have one drug here. In depolarizing, succinylcholine. Succinylcholine. In non-depolarizing, very big group. Tomorrow we talk about their name, Cureri family. Okay, it's enough for today class. Tomorrow we will learn about neuromuscular junction blocker. Then this antimuscarinic will finish. Okay, the system will over. Have any question? You can send me in group. Okay. Tomorrow we will talk about the remaining part of this chapter. Inshallah. Allah Hafiz. Assalamu alaikum.
Waalaikumsalam.
Waalaikumsalam. Thank you, sir. Sis Inin.